all over the country. We have 90.
We have a
We will go through our provincial current status. When you see say our province, those consultants,
pediatrics and also sometimes with the surgeons as well. But physicians, we should be able to look into that.
Honorable Minister, first of all, thank you for arranging this visit also, and also we were informed that the meeting was at the RDHS before. The minister is that now if there is some coordination that can be done with the line ministry and the provincial, the teaching hospital and the provincial hospitals, ideally, if the teaching hospital and the provincial hospitals can coordinate and do a cover-up basis for now, that can be an immediate measure that can be arranged since we have the provincial administration here, Honorable Governor is here, Honorable Health Minister is here from the central government. If some arrangement can be made for the provincial to fill out the shortages. Now, for an example, we had a hospital where without the MLT, the blood work we couldn't do. But if we can arrange a teaching hospital person to go and do a cover up there, that issue can be solved within this coming week. And even with the consultants, I know if the senior consultant gives the consent to a medical officer who is doing the training, the medical officers can also go ahead and do the work as consultants. That has happened in the past also. I think that's a coordination with the consultants that will have to be done. And also with some of the hospitals, I think the card creation has to be made. Now, Kalwanchuri Hospital was just an example where the permanent card for consultants is not there. So what we get, so those are fundamental things that can be fixed immediately. So if that can be fixed, even if you give consultants, Honorable Minister, we will not be able to have a permanent appointment in some of these tertiary hospitals. So those are administrative issues that can be resolved within a week. So because the new recruitment, new officers, all that, things will take some time. So if you can at least, based on your visit today, if some of these can be immediately rectified, that will be a very useful, very useful based on your visit.
Only one teaching hospital is better.
Yeah, we understand. Understand.
This is a bad
දැන් කැමැත්තනම රෝගලවල ස්පයික් කරනවා ඉන්ධන නැහැ කියලා කියනවා බෙඩ් නැහැ කියලා කියනවා බෙඩ් නැහැ කියලා කියනවා කැමැත්තන ප්‍රොටෙස්ට් කරනවා ඒක නෝ ඔබතුමා මොකද හිතන්නේ
ඖෂධ තත්ත්වය පිළිබඳව දැන් ගොඩාක් උණු තත්ත්වයක් තියෙන්නේ ඔබ දැක්ක මේ සාකච්ඡාවේදීත් ගොඩක් ଔෂධ ටික වෙලා තිබුණේ නැහැ ඉතින් අපි ක්‍රමානුකූලව ඖෂධ රට ලබා ගනිමින් තිබෙනවා ඉදිරි මාස 3ක කාලයක් තුළ ගොඩාක් තත්ත්වය හොඳ වෙයි වැඩ වර්ජන තත්ත්වයට ඇත්තටම එතුමාලගේ වැඩ වර්ජන අවසන් වෙලා තියෙන්නේ ඉතින් අපි හිතනවා ඒ සෑම කෙනෙක්ම සෞඛ්‍ය මන්ත්‍රාංශයත් එක්ක හොඳින් වැඩ කටයුතු කරලා රෝගීන්ගේ ජීවිත යහපත් කරන උදව් කරයි කියලා
දැන් ඒ ජනතාව කියන්නේ හිටපු අමතිවරයා කරපු බංජාව දූෂණ නිසා තමයි මේ විදියට රට වැටිලා තියෙනවලු මේ විදියට මේ ආර්ථික රට වැටිලා තියෙනවා කියලා මේ ඉන්ධනත් නැහැ කියලා රෝගලෙට් ප්‍රශ්නයක් තියෙනවා කියලා දිනවලු. ඒක නෝ මොකද හිතන්නේ?
රෝහල් වල එවැනි ගැටලුවක් දැනට නැහැ. රෝහල් වල ගැටලු පිළිබඳව සාකච්ඡා කරන්න තමයි අද මෙතනට ආවේ. රෝහල් වල මූලික අඩුපාඩු පිළිබඳව අපි අවධානය යොමු කරලා කටයුතු කරනවා. ඉන්ධන අඩුවීමක් ගැන අපිට වාර්තා වෙලා නැහැ. අනිත් එක ආර්ථික අර්බුදයක් 2022 වසරේක කනගාටුදායක තත්ත්වයක්. දැන් මේ ආර්ථික අර්බුදයෙන් ප්‍රමාණික රට කොට එළියට මිදුණා. ඒත් එක්කම 2024 වර්ෂයේදී අපිට රජය මගින් ඖෂධ ලබා ගැනීමට අවශ්‍ය ප්‍රතිපාදන සියල්ල ලබා දීලා තියෙනවා.
අමතිතුමා හිටපු අමතිතුමාගේ පංජාව දූෂණය ගැන මොකද හිතන්නේ?
දැන් ඒ සම්බන්ධයෙන් උසාවියේ කටයුත්තක් තිබෙනවා. ඒවා තාම අපිට උසාවියේ තියෙන කටයුත්තක් නිසා ඒ සම්බන්ධ උසාවියේ සම්බන්ධීකරණය කරයි.
ස්තුතියි.
Thank you.
To ensure that these are devolved subjects, a different matter. But when it comes to the patient care, central government and the provincial council has to work hand in hand. That's very clear. So that's the purpose of the discussion as well. So as you correctly indicated, if the consultants are willing to go and work in the nearby hospitals on cover-up basis, we can arrange that one. But we have to get the consent from them as well. We can.
No issues at least, but not that expected. But they are sending. But the retainability of the staff is very poor here because.
I don't blame them because it's far for them to travel. They come late, they leave early. If the Manampitia bridge is underwater, they can't even come. So if we can at least get the health assistance appointed from the district, that is
That now, so that's because of the government police for the recruitment. But if they get a chance, we'll surely give priority to your area. Okay, so
nurses, as Honorable Minister said already, we will be able to send the 74 nurses from the next batch. And
Our Ambala MP, former Deputy Minister Michael Azim, yes, here. Please consider the
Honorable Minister,
problem here. Please consider.
Honorable Minister, because then there will be less burden on the hospitals also. Yes.
We are not recruiting also, that we take.
So, Honorable Minister, there's a purchase order also. Purchase order was already issued, and the Holland company, the purchase order was already done, and the company in Holland didn't want to accept the credit note or something from the Sri Lankan bank because of the financial crisis. Now, since then, the price has increased again, but a purchase order was done in the previous minister's time. So, what we have to do is that follow that up, and once that's purchased, that you have to assure that it will come to Batipur, because the Satya Sai Baba Hospital, that's a private hospital. They are doing charity work here. So we can't put the entire government's burden on them. If we are to do that, then the government has to allocate them some resources at least, because they are doing a charity project here. They are able to manage 1 or 2 cases, but
We purchased under this JICA program, which came to a standstill because of the financial crisis. So we are in constant touch with the JICA, the agency, that in that one particular is included. If
During on the 16th February 2024, that the Eastern Front having an astonishing circumstance to pleasantly meet you all.
Prioritized provincial issues within the
Good morning. With Honorable Health Minister, City, I warmly welcome Ramesh Patel, okay. Director General of Health Service, Mr. Priyank Teljaviti. Hopefully we will have fruitful.
Thank you very much, sir.